There's a new study out that shows nearly every person involved who suffered a cardiac event, like a heart attack or a stroke, had at least one common risk factor. Christina Pei breaks down what that factor was.
The new research shows more than 99% of people who suffered a cardiac event like a heart attack or stroke already had a common risk factor.
I had had a lifetime of very severe heart disease, which I had mostly ignored and neglected.
Aaron Holm was diagnosed with a genetic condition that caused very high levels of cholesterol in his 20s after a misdiagnosis of heart arrhythmia. For the fit athlete who played volleyball for the University of Toronto, Holm's cholesterol should have been a warning sign, a sign he chose to ignore at the time.
I was just checked out. I tuned out I didn't go to a doctor for like 20 years.
For a while, he said he felt his chest clench up during workouts. Then, one morning in 2018, he went for a swim in Lake Sammamish.
And it happened in the water, and I couldn't reset. And so I thought I was going to die. I thought I was going to drown.
He made it back to shore safely, but decided to see a doctor. Tests later, doctors told him he needed quintuple bypass surgery because of a blockage in his heart. He was only 46 years old at the time.
That's the thing about heart disease is oftentimes it doesn't present. You have people that have issues and they look great. Like they look really healthy. They exercise all the time.
Holmes' case is similar to a global cohort of patients in the study published in the Journal of the American College of Cardiology this fall. It analyzed records of 7,000 U.S. adults and 9 million from South Korea for more than a decade. It concluded that most cardiac events don't strike by complete surprise. Four precursors like high blood pressure, blood sugar, cholesterol, and smoking went unaddressed before a patient experienced heart disease.
And the more of these risk factors you gather along the pathway of life, the greater your risk later in life of having a heart attack.
Dr. Sarah Speck is a cardiologist and medical director of cardiac rehabilitation at Providence Swedish. She says the first step to prevention is know your numbers.
Know what your cholesterol is, know what your blood pressure is, know what your blood sugar is. These are simple tests that any physician can perform for you.
She adds 80% of heart disease is under our control. Speck recommends a diet rich in fruits, vegetables, and fish, quitting smoking, and being active for even 20 minutes every day, which can translate into a healthier, longer life. For Holm, his cholesterol is now low thanks to medication.
Seek out people who've had the similar experience. So find a way to talk to someone who's been through what you're going through. Because you really, you don't have to be alone.